Operated, serving the Tri-County area, Palm Beach, Dade, and Broward counties for the last 25 years. The practice of medicine is changing dramatically. All County Healthcare, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare Home Care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision, and only your decision, on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096. The opinions expressed on the following sponsored program are strictly those of the host, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors. Amp2.tv presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Hello, South Florida and beyond, and welcome to the You and Your Doctor show, living a longer and healthier life. This evening, we're going to be talking about foot and ankle surgery and podiatry with a doctor who's very busy in Palm Beach County here in the Delray Beach, Boynton, Boca Raton area, and on staff at Wellington Regional Medical Center. He's also board certified by the American Board of Foot and Ankle Surgery. So without further ado, I'm going to get right to it. Dr. Adam Katz, welcome to the program. How are you doing this evening?
I'm doing very well. Thank you for having me.
Thank you, and for joining us on this adventure of health. I always tell the listeners and viewers that because we always learn so much in this program. We're so happy to have physicians participate in the program. I want to get right to it, though. Tell us a little bit about yourself and your specialty.
Okay, yes. So I'm originally from Long Island, New York, and I've been living here since about 2001. And I got my bachelor's degree here in Florida at the University of South Florida, and then I went on to get my doctorate at Temple University School of Podiatric Medicine, and did my surgical training for 2 years out in the suburbs of New Orleans. And since I've been here in 2001, I've been practicing out of a office location in Boynton Beach, and I have a second location in Wellington. My Boynton Beach location is at 8200 Jog Road in the Aberdeen Professional Center, and my Wellington location is in the Wellington Reserve, right off of 441. I have another doctor, Dr. Seth Minsky, that practices with me, and we are both board certified in foot surgery by the American Board of Foot and Ankle Surgery, and we basically provide quality care of all foot and ankle disorders for children, adults, and seniors. We do conservative treatments as well as advanced surgical procedures. We treat bunions and hammer toes. We treat heel and arch pain, fractures and sprains of the foot and ankle. We treat arthritic joints and with joint replacements and fusions. And we also do a lot of diabetic foot care, and so you want me to keep on going? Or?
Oh no, that's great, Dr. Katz. That is great information, and I'm finding after I wanted to ask you that question first because after reading your bio, I have a lot in common with you as well, except for being a doctor of podiatry. But besides that, a lot of tie-ins. I'm a Boynton Beach resident. played football with someone who played on one of USF's first team. So that's University of South Florida in Tampa is where you did your undergrad, right?
Yeah, that is correct. It's been a long time. But, yeah.
And my last part is I have a lot of foot and ankle issues, so I may be talking to you, but let's talk a little bit about, so you treat adults and children, so that's anyone, what is the main group of the age range that you treat, and tell us the parameters of that too, starting with youngest to oldest.
Okay, I mean, I've treated infants, to be honest with you.
Oh, wow.
And all the way up to seniors. We definitely, in my Boynton Beach practice, I definitely see a lot of seniors, but I also have a pediatric group downstairs that sends me up, a lot of kids with heel pain. Something called calcaneal apophysitis is very common in kids. Usually starts out around age 8 when they get a secondary growth center. And it's not fused, and very active kids, they get a lot of heel pain and inflammation in there. So that's a common thing that problem that kids have. I see a lot of kids with warts, ingrown toenails they come in with, fractures and sprains. See a lot of adults, mid-age, like myself, 48. See kids with, adults with they get a lot of heel pain as well, bunion and hammer toe deformities, Achilles tendon problems. And seniors, we definitely see a lot of seniors with, that are diabetics. That's a big problem. And diabetics definitely have a lot of problem with their feet. So we see the whole gamut here. We're pretty well-rounded practice.
Now, starting with children, are there a lot of we describe you as a foot and ankle surgeon, but are there a lot of also non-surgical treatment plans starting with children, some of the ailments you mentioned there?
Yeah, absolutely. I definitely believe in starting conservative, and surgery is always usually the last option. I definitely believe in educating my patients well and making sure they know all their options, but we usually try the conservative treatments first. It depends on what specific what we're talking about, but there's usually going to be conservative treatment options. I definitely had a few innovative, new technologies that I wanted to mention to you that are, helping a lot of patients in my practice. There are 3 things I wanted to mention to you. One is something called pressure wave therapy, and it's basically a highly effective treatment method for both acute and chronic pain, and it involves high energy sound waves, and it's basically a non-invasive treatment, and it's pretty much shows a 91% success rate according to clinical studies, and it correlates in my practice. It's great for all kinds of sports-related injuries, such as tendon and ligament injuries, heel pain, and Achilles tendon problems that I see in my office. Great option before considering surgery, and it basically works by accelerating the healing process in the body by stimulating the metabolism to enhance the blood circulation and regenerate damaged tissue. So it doesn't require any anesthesia or anything like that. So it's very effective.
Wow, that's a great therapy option, and we're here with Dr. Adam Katz. He's with Premier Podiatry Group. Like he said, they have offices in Boynton Beach and Wellington, but he has patients from all over Palm Beach County and Broward County as well. And on staff at Wellington Regional Medical Center, which I'm going to ask him a little bit more about. But I just want to make a quick point, Dr. Katz. That was great when you told us, about the conservative management first and surgery is the last option, because, with kids and even adults, sometimes it's the hardest part about coming into the office is thinking about, how this is going to be managed. Do I have to have surgery? Or maybe you'll elaborate a little bit on this. when I was a kid, the big thing was with certain foot ailments was orthotics, and that was something that kind of eased me into seeing a podiatrist, because I played a lot of basketball, as the listeners and viewers know, early on in my life, and I had a lot of foot and ankle injuries and issues with my sesamoids. But things like orthotics, are those still being used today? Obviously, it's jumped in the last 30 years, but is that something that you still use in your toolbox?
Yes, absolutely. Orthotics definitely is a great conservative option for a lot of different problems that I see. Flat feet lead to bunions. You could develop a lot of problems when your arch totally collapses. You can get tendon problems. So we definitely use a lot of arch supports. We provide, we make custom orthotics, which custom orthotics are basically fancy arch supports. If anyone that doesn't know what an orthotic is, where we make a mold of the patient's foot, and we make something that's calibrated to their arch, that puts their foot in the perfect position, is calibrated to their body weight. But I also do have some good over-the-counter arch supports that I sometimes use prior to the custom ones, because nowadays, insurance companies don't always cover the custom ones, so it's good to have a less expensive option for a patient, when it's not covered by their insurance and they have to pay for it out of pocket.
Most definitely, and that's something, if someone hears or views this program, they can call your office at Premier Podiatry Group and ask those questions about coverage and whatnot.
Absolutely, and just so the listeners know, you can reach either one of our offices at 561-364-9584, and we also do have a website, premierpodiatrygroup.com, and we are also on Facebook under Premier Podiatry Group. And
it's a fantastic website. I'm actually on it right now as we're speaking. That's where I'm getting some of my questions, and how you have a great bio there. That's why I wanted to ask you early on, just to share your educational and background as well. Let me ask you, we talk a lot about on this show about diabetes. I have a lot of vascular surgeons on the program, internal medicine, and early on when I was interviewing, I'm a journalist by trade, and early on when I was talking to these doctors, I didn't know so much had to do with like the diabetic foot. So is that something that's a huge scope of your practice, I guess, diabetic foot care?
Absolutely. And, diabetes affects the small vessels, like you said, you talked to a vascular doctor about it. It affects the circulation to the foot. The microvascular circulation decreases, and over time you could develop something called neuropathy. With neuropathy, you lose the protective sensation in your feet, and when that happens, a lot of bad things could happen to your feet. So it's important to, as a diabetic, it's definitely important to get your feet checked out at least once a year. And my high-risk diabetics, I see them every 2 months. I take ear call, at 3 different hospitals, and, we do a week at a time. And whenever my week comes up, there's always a few diabetic foot emergencies where unfortunately, I'm cutting off part of someone's foot, or I'm opening up their foot to drain an abscess or something of that nature. Then a lot of times, these patients don't even know they're diabetic, or they're just really poorly controlled. And, it's important that a diabetic works with their internist or an endocrinologist and keeps that blood sugar under control, because that's what leads to all the the bad problems when you get out of control, when you're just not well controlled.
And I got to add right there, I've done a lot of medical writing for testimonials. It's amazing. There's always, with the diabetic foot and the diabetic issues, there's always a podiatrist at the center, or foot and ankle surgeon, and they seem to be like almost like a quarterback of the team there, and they normally work with internists and sometimes vascular surgeons, but that team approach, and I think you were just alluding to that, is just amazing. We're here with Dr. Adam Katz. He's American Board of Foot and Ankle Surgery board certified surgeon, podiatrist. Hold that thought, though, Dr. Katz. We're going to take a quick break, and on the other side, I'm going to ask you about the importance of yearly foot exam and what is checked on the You and Your Doctor show.
Okay, sounds good.
All County Healthcare, Inc. is locally owned and operated, serving the Tri-County area, Palm Beach, Dade, and Broward counties for the last 25 years. The practice of medicine is changing dramatically. All County Healthcare, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare Home Care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision, and only your decision, on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096. You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask, but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
And we're back with Dr. Adam Katz. He's a podiatric podiatrist. He's a surgeon, foot and ankle surgeon, board certified as well. And I see everyone watching on Facebook Live. We had 5 viewers there. You can always see the show there at All County Healthcare INC on Facebook. And Dr. Katz has a Facebook page, Premier Podiatry Group. Just type that into the search bar. And his website, a lot of info on there, premierpodiatrygroup.com as well. And if you have any questions, we have Dr. Katz here till 6:30, numbers 888-565-1470, and we'll try to get you on the air. Dr. Katz, before the break, we were touched on so many different subjects. I'm a little excited here to talk to a podiatrist who has this type of background. There's so many different areas of interest that you cover, but I had teased before the break, how important is it to have a yearly foot exam? And I'm 40 years old now. I'm an adult. Is that something that at this age range I should be thinking of? Should I have thought of it before in maybe my 30s or 20s, or even the teens and children, or something older in age, like the baby boomer population is really growing in the country we hear about? So when is it important to get that yearly foot exam?
Get a yearly foot exam. I mean, diabetics definitely need to get a yearly foot exam. But anybody that first of all, if you have any kind of pain or something doesn't feel right in your foot or ankle, you should get it checked out. If you have pain or discomfort, it's for a reason. And a lot of times it starts off as a simple problem that we could take care of a lot easier than if you let it go, and by the time you come in, you have a severe deformity, or it's a more complex problem. But with that being said, there's a lot of people are walking around with flat feet, or simple things like you said that can be fixed with an orthotic. But if they don't, it ends up leading to plantar fasciitis or heel spurs, which is basically heel and arch pain, or can lead to bunions and hammer toes, or other type of foot deformities, when it would have been that might require surgery, when it could have just been a simple conservative treatment if they came in earlier.
Now, you mentioned bunions. Is that something that you see a lot of from women from wearing high heels, or is that something that's more genetic, and can it happen to men as well?
It definitely could happen to men as well. There's definitely a genetic predisposition towards bunions. You definitely see it in families. You see, grandmothers, and daughters and mothers. They all have the bunions. But it's also affected by the shoes that you wear and stuff like that. You might have two sisters with the same genetics, and one sister, that's wearing the high heel or the really pointy shoes, it might accelerate and happen a lot quicker. But I mean, today I had a middle-aged gentleman with a severe bunion deformity, and he's not wearing high heel shoes or narrow shoes, but he just had a genetic predisposition towards it. He had a really flat foot. He's someone that maybe we could have slowed it down if we got him in arch supports earlier, and that would be the conservative treatment. It would be the arch supports and stretching that Achilles tendon and wearing shoes that are extra depth. But I did, now that we mentioned bunions, one of the things that I really wanted to talk to you about today is a new procedure that's the latest technological advancement in bunion surgery called the Lapiplasty. And I'm definitely excited to talk to you about that because to me, that's a game changer, the way us foot and ankle surgeons perform bunion surgery. So for the viewers that don't really know what a bunion is, do you mind if I give a quick explanation?
Oh, yeah, definitely. This is fascinating.
So a bunion is, when you basically, the common person, they look at their foot and they see a big bump at the big toe joint. They see a bump protruding. That's a bunion. So really what's happening is the big toe comes off a long bone called the metatarsal. That first metatarsal bone is unstable and it's shifting outwards, and it's rotating, and it's elevating. It's moving in three planes. And, traditional bunion surgery was either, the old timers, they would just hack it off and release some soft tissue, and there was a high reoccurrence rate. Then we started doing what we call, osteotomies at the level of the head, where we cut through the bone, we'd slide the head over, and we'd actually create a deformity to fix this protruding bone. But the reality of it is we were correcting it in one plane only, maybe two planes. We weren't correcting that rotation. So the joint was still out of alignment, and at the base of that metatarsal, that's where the deformity is really occurring from. That was an unstable joint, and that joint's still unstable with those corrections. And that's why there's a high incidence of reoccurrence with that type of procedure. And unfortunately, a lot of my colleagues are still, that's their go-to bunion surgery, And along came the Treese Lapiplasty, and they talked about, correcting it in all three planes, and they made this technologically a lot easier. I've been doing lapidus bunionectomies for a long time, but we'd have to freehand it. We'd make our cuts, we'd eye out our cuts, and it required. I'd only do it for really severe cases because it required a non-weight bearing period for like 6 to 8 weeks. Well, what Treese did is they developed a system where we dial in our exact correction, exactly where we want it. We correct it in all three, hold the correction in all three planes, and then it allows us to use a cutting guide, a template where we make our cuts for the correction very precise, very scientific, and they also have a great stabilization system that uses two mini plates in two different planes that allows for almost immediate weight bearing. It's very stable. So most of my patients, within 2 weeks, they're walking around, in a boot after this procedure, and it's restoring normal anatomy. I think it's a game changer. I think eventually, all foot and ankle surgeons should be doing their bunion surgery like that. And both myself and my associate were both certified to do this Lapiplasty, which is the most innovative, latest technological advanced bunion surgery out there right now.
Wow, there you have it, folks. I mean, that's why we do this show. We're getting the latest and greatest. I had never heard of that, and I'm so happy that you're offering that to the community of South Florida. And
like I said before, because you're fixing it at the root cause, it's very stable, and you don't get reoccurrence like you would with traditional bunionectomy. And so it's just a much better result. You're realigning that joint, see less arthritis in the joint afterwards. You don't wear it out like you would when it's out of alignment. It's like having a tire is out of alignment. You're going to wear out the tires quicker.
Dr. Katz, it's hard to believe we only have less than 2 minutes, but I have a quick question. Susan Eves from Facebook asks, how do you treat heel spurs and what causes them?
Okay, I'd love to answer that. Before I do answer that, one thing I need to plug, because I'm going to be doing a lecture on lapiplasty on Saturday, June 2nd at 8:30 a.m. at the Wellington Community Center. And they can sign up on my website, at premierpodiatrygroup.com. They can sign up on Facebook at Premier Podiatry Group, or they can call into the office at 561-364-9584. Thank you.
We got about a minute. If you could just tell us the heel spurs, and then we'll get that info out.
So what the question is what?
How do you treat heel spurs and what causes them?
Tell me when I can go.
Oh, go ahead.
Commercial?
Yeah, no, you're good.
So heel spurs is probably one of the most common things I see in my office. I see about 6 or 7 patients every day with that. The arch is collapsing. We talked about flat feet. As the arch collapses, the foot gets longer, and you have this plantar fascial ligament that runs from the heel all the way across the bottom of the foot. As that foot elongates, that plantar fascial ligament pulls out the heel, and it results in inflammation and pain. We call that plantar fasciitis. Itis means inflammation. Plantar fascia is the name of the ligament. But over time, that pulling results in the bone spur growing in the direction the ligament's pulling towards the toes. So the conservative treatment is, again, arch support. You stop the arch from collapsing and stop that ligament from pulling.
That's amazing, Dr. Katz. We'll have to have you back on. I'm sorry we run out of time, but it's premierpodiatrygroup.com. Thank you.
Thank you for letting us share with you a longer and healthier lifestyle. If you have a doctor or are a doctor and wish to be on the show, call AMP2 TV at 866-244-5422, and we will put you on the air as soon as possible. Tune in next week for more information on living longer and having a healthier life. The opinions expressed on the preceding sponsored program were strictly those of its hosts, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors.